Today we're going to have a lecture on physical participation. Week 5 lecture. Previously, we have a lecture on behavior management strategy. For today, we having a lecture on physical participation, physical enabling for participation, physical activity. So I will upload the materials after the lecture. So for today, we're going to start our lecture. So hang on, So we got another 2 weeks kan? 1 week untuk semester break. Anyone? We got another 1 more week to go kan? Next week.
Betul sir.
Ada 1 more week, then after that we have a break lah. So I know you all semua quite tough lah dalam ODL ni, banyak yang you kena participate dalam online ni. So for today, physical activity for mental health. They call it this physical activity is very important for OT. So OT we should well versed on designing physical activity with patients. So you also have done your physical activity, the punya therapeutic value, theoretical frame of reference. I just to add more to add more on my lecture regarding this physical activity. So when talk about this is from Department of Health, London, 2004. They said that physical activity causal link protects against cardiovascular. That is evident. This is the level 5. Level 5 from Department of Health, London. They have a committee, and then their finding, they said there is a link between cardiovascular disease, obesity, diabetes, hypertension, and musculoskeletal disorders. So in terms of physical activity, yes, there is a link. There is a benefit. There is benefit that all the disease have benefited from this physical activity. How about mental benefit? When talk about physical activity for mental benefits, it's quite substantial. It's changing. And I will discuss more on the benefits for mental, for physical activity for mental patients. For today, it's mostly on the evidence-based and also how to conduct the individual punya individual and group for physical activity. So can you all differentiate between physical activity, exercise, moderate intensity physical activity, and another one, lifestyle activity? Anyone of you can differentiate? Boleh tak differentiate? Physical activity, exercise, moderate intensity physical activities, and also lifestyle activity. So it's quite different. It's quite different when talk about this these activities. So from this from the book of Jennifer Crick, of OT in mental health, they describe this. We have to know the difference between this activity. When people describe exercise, what it means. When the people describe lifestyle activity, what it means. So when talk about physical activity, it is any force exerted by skeletal muscle that result in energy expenditure above resting level. This is by Health Education Authority in 1994. This includes the full range of human movement from competitive sport and exercise to active hobbies, walking, cycling, or activities of daily living also can be considered as physical activity. So when you doing activities of daily living, for example, you do mopping, you go to sport, you do your active hobby, for example, you play badminton, all that, it's considered as physical activity. This means that there is a movement of your skeletal muscle that result in energy expenditure above resting level. So whatever you do that involve your skeletal muscle above resting level, they call it physical activity. So how about exercise? Exercise is a subset of physical activity. It's subtopic, they call it subset of physical activity. Is volitional, planned, structured, repetitive, and aim at improvement or maintenance of aspect of fitness of health. Health Education Authority. So, for example, I play golf. I play golf is some sort of exercise because when talk about volition is your interest. You must have motivation to do, and then this must be planned. Plan is that you do it weekend, every morning, you do it, and it's repetitive. For example, like you do, some of people do exercise of cycling. Sekarang ni trend baru kan, ramai yang suka terlibat dengan cycling, especially lagi Datuk Siti Nurhaliza sekarang ni sibuk dengan aktiviti cycling. So people ada volition, ada motivation untuk buat tu. So they do it regularly. They structured. Every weekend, Saturday, Sunday, they cycling from Bandar Baru Bangi to Seremban. So every weekend, they are the group. So they do it. So when talk about exercise, it's a subset of physical activity, which you must have volition to do that. You have motivation to do that. It must be planned, structured, repetitive, and aim improvement of maintenance of any aspect of fitness of it. So people yang do exercise ni, dia akan monitor dia punya performance dia. Dia ada improvement ke tidak. So dulu kalau you cycling, for example, you cycling from Bangi to Semenyih, berapa kilometer tu? Around 35 kilometer. Then you want to improve. Then you from Bangi you go to Seremban. So it's about 75 kilometers. So when talk about exercise, something that you want to improve that. For example, you do jogging, kan? Every evening you do jogging. So you want to improve your jogging. Mula you boleh buat 3 round. Then after that you improve to 4 round, 5 round. But you must maintain it. They call it exercise. Then another wording they call it moderate intensity physical activities. This is the objective to raise the heart rate sufficiently to the level where the pulse can be felt and the person feels slightly out of breath. It seems that a feeling of increased warmth, possibility accompanied by sweating on hot or humid days. So this moderate intensity physical activity is a way for people yang do physical activities involve monitoring. For example, patient yang ada cardiac issue, dia ada blocking ke, dia ada macam-macam aneurysm ke, dan sebagainya. So, they do moderate intensity physical activities in order to avoid the risk. Want to avoid the risk. They call it, there is a moderate intensity physical activity, and also there is also, for example, mild intensity physical activities. If you learn cardiac management of cardiac event, they based on MTM, metabolic, MET, metabolic energy time. This is, they calculate the energy for every physical activities. So different type of physical activity, there is a MET level, they call it. MET level, metabolic equivalent time. They already calculate. For example, like if you swimming compared to walking, sure, swimming dia punya MET lebih tinggi daripada walking. So depend on your condition. So this include everyday activities such as brisk walking, climbing stairs, certain form of household chores and occupational tasks, as well as active recreation like swimming and dancing. So people who have condition such as cardiac problems, stroke, and terminal illness, so they have to follow the intensity of physical activities, whether it's mild, moderate, or severe. Aggressive intensity of physical activities. So depend on this one is more control based on the pulse rate and also the MET, metabolic equivalent time. So this is called moderate intensity physical activities. Then there is also activity, they call it lifestyle activity. Lifestyle activity, activities that are performed as part of everyday life, such as climbing stairs, walking, for example, to work, school or shop, and cycling. So this is lifestyle. You do this activity for your lifestyle, I mean your routine. Some people, they go to work by cycling. Some people like to go to work by walking. Even though they have car or motorbike, but they rather use, for example, MRT, LRT. Then after that, they walking. So it become everyday life. They call it lifestyle activity. They are normally contrast with program activities such as attending a dance class or fitness training session. This is different. And activities that being programmed, such as dance class or fitness training session, is not a lifestyle activity. When talk about lifestyle activity, involve part of your everyday life. For example, if you stay at college, you remember you stay at college, for example, like college Angsana, college Rafflesia. So what is your lifestyle activity when staying at the college? You walking. You walking from college Ansana, go to FSK every morning and every evening. So this is your lifestyle. So you all walking ke naik bus? pergi apa ni? Pergi college. Semua ada, masih ada.
Bas.
Naik bas.
Kenapa
Jalan
naik bas?
kaki.
Kenapa tak jalan?
Jalan kaki je.
Jalan kaki.
Jauh.
Jauh?
Dahlia jauh se.
Dahlia, itulah you all muda-muda. Patut jalan kaki ke, nak basikal, cycling ke. Kan? Sebadan sihat, bertenaga. So make it as your lifestyle. You tahu tak, profesor dekat Monash University, masa tempat I duduk belajar PhD dulu, all the professor go to dia punya office by cycling. Cycling, dia punya lifestyle activity every day. Part of dia punya everyday life, cycling. So but indirectly dia dapat exercise, dapat apa ni, dia punya bertenaga, dapat relax dia punya mind bila cycling. So when talk about this activity, whether lifestyle activity ke, intensity, physical activity ke, exercise, so there is a recommendation. Recommendation, they said 30 minutes per day. They call it moderate intensity. 5 or more days per week. 30 minutes a day. Kalau you buat exercise for 5 days, they call it moderate intensity. Kalau saya ni, kan musim apa? Musim COVID ni kan. Saya punya lifestyle activity, selepas main subuh 6.30 saya akan berjalan di UKM sana. Saya buat main golf, jalan kaki. So every day 6.30 I dah dekat sana. Habis pukul 9. Pukul 9 pagi. Dan balik, mandi, dah ada start lecture dan sebagainya. So I spend masa I kat sana lebih kurang 6.45, 7.45, 3 jam. So consider apa? Moderate ke? It cannot be considered moderate kan? Sebab every day 3 hours. 3 hours. So I do it 4 days. 4 days per week. 4 times per week. You can consider bukan moderate lagi dah. You can consider aggressive, severe intensity. Itu sebab kadang-kadang sakit lutut dan sebagainya kan. All in one session or several shorter, 10 minutes or more. They call it lifestyle or structured or combination. Kalau yang ada 10 minit atau lebih, bukannya everyday, dia panggil lifestyle. Children and young adults, 60 minutes a day, each day. So you all ni, yang young adult ni, you have to spend 60 minutes per day doing exercise. Macam sekarang ni dekat rumah COVID, musim COVID ni, apa you buat dekat rumah? Ada tak you spend masa 60 minutes per day? Hello? Ada ke tidak?
Makan.
Tak exercise? Tak jogging?
Jarang exercise. Kat katil.
Kat katil dia. Allah, kenapa lah you all? I dulu, masa I belajar dekat KL, I buat attachment dekat KL. Every day. After 5 je, I pergi ke Tasik Titi Bangsa. So, I jogging kat situ. 3 round, 4 round every day. I spend masa 60 minutes per day. So, you all pun have to take care of yourself. Maintain it as your punya physical activity, exercise, 60 minutes per day. Older adults, take particular care. So older adults yang 60 above, I not consider myself older adult lah. Still belum sampai stage tu. So 60 years above, they have to take particular care. Even my friend yang dekat, when I walk, play golf every morning, dia orang semua umur dia 60 ke atas. But they still fit. They can still walk 3.5 km every day, every morning. Dia boleh jalan. Ada yang dah kena stroke pun boleh jalan lagi. 3.5 km per day, every morning. Dia jalan. So you all, yang adult ni kena buat something. I tengok dekat Facebook, alumni OT, petang dia buat exercise, dia catatkan 4.5 km, 6.5 km dia buat jogging. You all pun kena buat. So this activity so this is the table 15. When talk about activity menu for adults and children, young people, this from Department of Health. This is what they should do. 60 minutes every day for young people. So young people 60 minutes per day. You ingat you mesti buat exercise 60 minit, 1 jam. So you can do organized activity in clubs such as football, badminton, judo, walking, cycling to work, a school or social event, therapeutic exercise. But therapeutic exercise ni, people yang dah suffer stroke ke dan sebagainya, they call it therapeutic exercise. Weekend family activity, example trips to the countryside and parks for walk. So besok you dah berkahwin dan sebagainya, buat weekend family activity. Pergi buat trekking ke, kan? Every weekend dengan family, naik gunung ke, panjat bukit ke. Then kalau you tak boleh buat macam ni, informal activity with friend, for example dancing ke, skateboard, swimming. Swimming ni yang paling bagus sekali. I remember while I belajar dekat Australia dulu, anak Mak Saleh ni, dia kalau swimming training dia start pagi-pagi dah start training. Pukul 6 pagi. Dah start training. Dia start sekolah pukul 9. Lepas training swimming, dia pergi kelas pukul 9. That's why they all negara yang handal dari segi swimming dan sebagainya. Sebab memang latihan dia, memang dia really go for it. Occupational work related activity, school breaks, lunch time, and after school activity, playground time. So macam kanak-kanak pun dia kena pergi break, kena ada break lunch time and play dekat playground. Quality physical exercise, quality physical exercise and school sport. Kena ada. Di sekolah mesti ada sport, kan? Kita ni tak macam di overseas. Dia punya sport bukannya 1 bulan je tu. Ini tak. Macam kat Malaysia ni, sebulan sport dia sebulan. Patut dia kena regular. Every week kena ada sport. Then after that ada pertandingan. Lepas training ada pertandingan. Ini tak. Sebulan tu. Lepas tu tak ada dah. Recreational walking, dancing, cycling. This one you can do. Sekarang ni popular cycling. Datuk Siti Nurhaliza ada cycling dekat Bukit Tinggi, Genting Highland. Itu ramai pergi sana cycling. Individual activity, jogging, swimming, aerobic. You can do it. Individual activity, jogging, swimming, aerobic. Dulu I sukalah buat jogging, tapi kadang jogging ini tak ada competition. It's your own. Kalau main golf tu boleh compete dengan kawan-kawan. swimming, aerobic, volunteering and leadership activities also can be defined activity for adults and children and young adults. So this is the thing when you design physical activity, exercise, you can do it with your psychiatric patient, all these things. So this from UK also, grant 2000, recommend national consensus level 5, recommends statement for exercise. Statement for exercise for condition of depression. So patient who have depression, anxiety and stress, problem, they can do exercise. Who have emotion and mood, for example like personality disorder, dia ada moody type of personal mood, emotional type of personality disorders, who having a self-esteem, who having cognitive functioning due to stroke or death, and who having a psychological dysfunction, for example like post-traumatic stress disorder dan sebagainya. So boleh buat they recommend for exercise. It also can be done to schizophrenia. Schizophrenia patient, you all pun dah buat physical activity for schizophrenia. And then for alcohol and drug dependent. Drug dependent macam drug addict or that. If you do exercise, physical activity with them, it will be good. Subclinical level of mental ill health and major depression disorder. Major disorder is the this condition that's suitable for physical activity. These our student conduct exercise with a psychiatric patient. You tengok macam mana dia conduct exercise tu with psychiatric patient. So they bring them into department or bring them into ward. So this exercise they conduct it before they having activity. You tengok with the patient. Patient dia pakai baju hijau, uniform hijau ni. Sampai sekarang pun uniform hijau. Tak silap saya lah. Masih pakai lagi. Music tutup dulu. Stop dulu lah. Nampak tak semua? Nampak?
Nampak.
So, ini salah satu contoh warm up exercise dengan patient dekat hospital Permai. So kalau you tengok patient yang sebelah kanan tu, dia kadang-kadang dia tak boleh concentrate kan. Dia tak boleh fokus apa yang orang cakap. Dia ni macam bipolar juga tapi dalam keadaan hypomanic. So kadang student terpaksa buat cue kat dia. Guide dia dengan bantu dia untuk dia fokus dan sebagainya. Ada soalan tentang patient kat hospital ni dia buat exercise. Ada siapa nak tanya? Boleh tanya sekarang.
Doktor,
Ya.
exercise apa yang patient paling suka?
Oh, okay. Exercise patient ni kadang, you know, dia berkeadaan kadang-kadang dia tak ada insight, dia kadang dia whatever you do for them dia suka. Dia kadang dia tak ada a sense of choice, dia tak boleh buat keputusan kan. So whatever exercise yang penting kita buat exercise tu kita bantu dia. Kita prompt dia, kita bagi cues. You tengok kan patient yang sebelah kanan tu kan, dia kalau kita suruh buat, dia buat benda lain. Kadang dia dalam dunia dia sendiri. Kadang kita kena guide. Okay, good. Ada lagi nak tanya? Saya tunjukkan lagi. Ni, music tutup dulu. Stop dulu lah. Kalau you buat exercise dengan patient ni, berani tak agak? Anyone? You all berani tak buat exercise ni? Tak percaya?
Kalau ramai, berani.
Saya faham. Kalau ramai berani kan. Kalau seorang-seorang takut juga kan. Dia dipakai agresif. Tapi patient ni, kalau dia nak agresif, kita nampak dah. Dia macam dia renuh kayu semacam. Dia tak boleh, macam dia diam, stupor. Tu kan. Macam patient ni, dia able to follow you punya instruction. Dia boleh ada eye contact kat you. Kadang patient yang agresif ni, dia tak ada eye contact dengan you. So, dia dalam dunia dia sendiri. So this is one exercise that I can show you lah, in term of dekat hospital, staff of mind. So the benefit of physical activity, it can be biochemical mechanism, can be physiological and psychosocial mechanism. So these three things that you should know lah. Kalau biochemical ni, kalau you buat exercise, dia releasekan apa? Hormon apa? In term of physiological, you buat exercise, dari segi cardio thoracic apa dia? The more you intake you punya oxygen, the better for your heart kan. Tu kadang-kadang orang cakap kalau sayangkan bini, kalau sayangkan girlfriend, bagi dia banyak duit. So dia beli rantai, emas, dia suka kan. Kalau sayangkan jantung, kita buat apa?
Bersenang.
Exercise. Kalau you sayangkan jantung you, buatlah senaman. Buatlah exercise. Okay, bukan saja lelaki, perempuan pun. Kalau dia dalam keadaan sedentary, tak exercise, duduk, tidur, makan, minum je, especially musim COVID ni, dia punya prognosis untuk dapat heart attack pun senang. Dapat penyakit pun senang. So you all kena exercise. Ada orang nak masuk ni, sorry, ada Arif nak join. So you have to be clear about this this mechanism. So I want you all to read this management of major depressive disorder. Major depressive disorder, dia ada banyak cerita tentang benefit of exercise or physical activity for major depression. So as you all know, I pun dah terangkan, so dia using Catalonian Agency for Health Technology, dia punya level of evidence. So level 1, meta-analysis. This is level 1. Systematic review, RCT. Tu dan. So this dia kat dalam guideline ni dia akan tulis level. Dan ada kalau guna apa ni, modified from the Scottish Intercollegiate, dia ada grade A, B, C. Kalau WFOT, level 1, 2, 3, 4, 5. So, dia punya guideline ni, they said, exercise therapy generally consists of structured and supervised exercise activity of 45 to 60 minutes per session up to 3 times per week and prescribed for 10 to 12 weeks. When talk about exercise therapy ni, dia mestilah structured. Every session at least 45 minutes and 3 times a week. Then we can consider exercise. Kalau setakat buat 10 minit, buat seminggu sekali, it cannot be considered exercise. So they said exercise may be used as a form of therapy in the management of depression. Kalau you manage orang depressed, you buat exercise as a therapy. Several mechanisms of action has been postulated. So when you want to conduct patient yang ada depression in exercise, must be 45 minutes at least per session, 3 times per week. And you kena prescribe 10 to 12 weeks. Maksudnya 10 to 2 bulan setengah. 2 bulan setengah, 3 times a week, at least 45 minutes. Barulah you dapat benefit. There is evidence that favorable exercise will not assist in reducing this depressive symptom. So level 1. Level 1 maksudnya bagus lah. Kalau ikut apa ni Spanish itu level 1 memang terbukti lah, tapi dia punya exercise tu mesti 3 kali seminggu selama at least 45 minutes selama 10 minggu hingga 12 minggu. Kalau you dapat patient yang ada depression, so you punya program mesti buat exercise. Sebab evidence shows that level 1 evidence. So there is evidence to support the effectiveness of exercise in the clinical population of depressed patient. So favorable exercise, kalau dia compare exercise dengan no exercise, exercise ni boleh reduce depressive symptom. So, woi, sekejap kelas, sekejap Sekejap. Ada kelas lah. Ada kelas lah. Lama lah. Ini serius ni. Kerja. Kau macam ni. Nanti break sekejap. Kelasnya sorry. Tadi ada, yalah, bila kat office ni ada banyak gangguan. Ya. So, there is some evidence that exercise therapy may be as effective as antidepressant medication in achieving remission in depression. Maksudnya exercise therapy sama kesannya dengan antidepressant medication. This is finding dia. So level 3. So kalau you dapat patient yang depression ni, Dekat you punya department, you mesti buat 3 kali seminggu 45 minutes. 45 minutes you buat bersama dengan orang sebab there is a evidence, level 1 evidence compared to no exercise. No exercise contoh apa? You buat jahit ke, dan you buat semua tu, dia favor compared to no exercise. Another from this guideline, patient of all ages with mild to moderate depressive disorder can be recommended for exercise therapy. This one from Scottish. Scottish cakap grade A. Baguslah. All ages with mild to moderate depression disorder. Mild to moderate, bukan severe, grade A. You can recommend exercise therapy. Exercise therapy can be prescribed as adjunct to pharmacotherapy in the treatment of depression if agreeable to the patient. So when they give them antidepressant drug, they also can do exercise because there's evidence grade B. But patient must be consent. Giving consent, dia setuju untuk buat exercise. So it can be done to the patient kalau dia ambil ubat. Dia ambil ubat pun boleh. So exercise therapy, there is evidence that exercise improve mood and reduce depression in elderly people. So kalau you ada patient elderly, dia ada issue of depression, anak dia tak balik rumah due to the COVID, hari raya tak balik kampung. Exercise ni dapat improve the mood and dia punya reduce depression. Kalau dia exercise, dia tak ingat lah. Kalau saya buat exercise pagi ni, saya pukul 9, pukul 9.30 saya dah tidur lah. Letih. Tak fikir apa. Relax je. Pagi pukul 5 dah bangun. So, actually, memang betul. I pun happy dia, tak apa. Mood okay dia kan. There is evidence that exercise reduce depressive symptoms in elderly patient who respond poorly to medication. So, if there is elderly patient who have depression symptom, there is evidence exercise reduce dia punya symptom. Kalau dia tak makan ubat, tak suka makan ubat, exercise. Level 3. So recommendation also, elderly patient with mild to moderate depressive disorder can be recommended for exercise therapy. Elderly yang ada depression disorder, mild to moderate, memang dia recommend grade A. Using Scottish punya tu. Exercise therapy can be prescribed as adjunct to pharmacotherapy in the treatment of depression if agreeable to the patient. This another study. Effect of exercise on mental apa ni? Effect of exercise on mental and physical health parameters on person with schizophrenia. Ni dia buat study 16-week walking program for outpatient. Dia buat program exercise dengan berjalan dia selama 16 minggu. 6-minute walking distance, body mass index, percent body fat and severity of psychiatric symptoms were measured. Experimental participants in the walking group experienced significant reduction in body fat compared to a control group not participating in the study during the same time period. So, dia buat dalam 10 orang, dia buat 6-minute walking distance saja. So, experimental participants also had greater aerobic fitness, lower body mass index, and fewer psychiatric symptom than control at the conclusion of the control. So dia dapat fitness, aerobic fitness. Compare you tak buat exercise tu, reduction of lower body mass index, and fever psychiatric symptom. Psychiatric symptom with schizophrenia, you tahu kan, positive, negative symptom. So this dia punya study, even dia buat study ni 10 case saja. Ini lebih kepada clinical trial lah. Dia tak buat dengan random. Random dengan control group tak ada. Ni dia compare. Exercise in prevention and treatment of anxiety and depression among children and young people. So 16 studies with a total of 1,191 participants between 11 and 19 years old of age were included. So this study dia buat exercise as a prevention and treatment of anxiety and depression among children and young people. So dia buat study, ada tak ada kesan between yang among children yang ada anxiety and depression dengan compare yang normal. So dia buat exercise. One trial found no different depression score for children in treatment. No study reported anxiety. So dia punya conclusion dia, whilst there appears to be a small effect in favor of exercise reducing depression and anxiety scores in the general population of children and adolescents, the small number of studies included and the clinical diversity of participants, intervention and methods of measurement limit the ability to draw conclusion. It makes little difference whether the exercise is high or low intensity. The effect of exercise for children in treatment for anxiety and depression is unknown as the evidence base is scarce. Maksudnya, dia buat aktiviti ni pada young people, among children and young people, tak dapat finding dia. Sebab dia punya sampel mungkin, dia punya method tu tak sesuai dan sebagainya. The effect of physical exercise to mental state and quality of life in patients with schizophrenia. The purpose of the study to examine the effects of 10 weeks of physical exercise program on mental state and quality of life of individuals with schizophrenia. The study involved 30 inpatient or outpatient with schizophrenia who were assigned randomly into aerobic exercise group and control group. So dia buat dengan 15 yang eksperimen aerobic exercise, yang kontrolnya 15. They said there were no personal difference such as age, gender, disorder, duration, medication or use between the both groups. An aerobic exercise program was applied to the subject group. The period of 10 weeks, 3 days in a week. Data were collected by using the brief symptom inventory, the scale of the assessment of positive symptom, the scale for the assessment of negative symptom, and to the both group before and after the exercise program. After the 10-week aerobic exercise program, the subject in the exercise program showed significantly decrease in the scale for the assessment of positive symptom. After 10 weeks, dia punya positive symptom menunjukkan kurang, decrease. The scale of assessment of negative symptom and the brief symptom inventory points and their World WHO quality of life scale, Turkish worsen point were increased than control. So, dia punya negative symptom, dia punya quality of life meningkat. Dia punya apa ni, kontra lah. WHO quality of life ni kalau tinggi skor dia, maksudnya makin bagus. So this result suggests that mild to moderate aerobic exercise is an effective program for decreasing psychiatric symptom and for increasing quality of life in patient with schizophrenia. So, kalau besok you kalau kerja di hospital, your department, you kena buat, kalau ada pesakit schizophrenia, inpatient ke outpatient, you boleh buat aerobic exercise. Sebab dia dapat reduce dia punya positive and negative symptom, at the same time improve dia punya quality of life. Quality of life. This one done at the Turkish, Turkey. So when we're going to conduct physical exercise, physical activity, there is a barriers to participation. What is the barriers? It's going to be a barriers for you, especially one is when you want to select physical activity. So selection of physical activity must based on the environment at your punya department. Some of your, contoh macam tempat you, contoh dia hostel Permai. Sekarang ni dulu hostel Permai, dia punya landscape dia cantik. Landscape dia dia ada apa ni, walking compound, dia ada circle punya, dia punya bangunan in circle. So banyak aktiviti yang kita boleh buat, physical activity macam walking ke jogging. And then kalau yang melibatkan you punya yang nak keluar, nak pergi outing dan sebagainya, depends. So selecting physical activity depends on your environment also, and also your policy, hospital policy dan sebagainya. Kadang ada hospital yang tak boleh, tak benarkan buat physical activities. Mungkin space dia kurang dan sebagainya. And motivating factors. Patient kadang dia ada problem of motivation, volition dan sebagainya. So these are factors will be a barrier. Not only patient, but also your staff. So kadang staff ni dia dah complacent dengan aktiviti yang lama. So when you come over there, you punya plan of intervention based on evidence. But because of they are complacent with the activity yang sama, so it's going to be difficult for them. Even not only staff, patient. Patient ni kadang-kadang dia dah biasa buat kerja yang stereotype ni. Kadang susah nak motivate dia orang. And then value of participation. Value, if you don't understand the benefit and then you not value of this physical exercise pun, kadang-kadang seorang tu dia value macam I play golf ni, asyik cerita I je kan. I play golf ni, I value because I'm when I walk there, it's a green area. I seronok duduk situ. Jalan tengok pokok hijau, udara bersih, jumpa kawan-kawan yang bulat air gurau, cerita sambil berjalan tu. I value that. It's like my lifestyle activity. And then physical activity to enable other occupational goals. So sometimes you target the doing physical activity, ada goal yang lain. Setengah orang kan kalau dia buat physical activity, ada dua benda, kill two birds with one stone. Ada setengah orang dia cycling, tujuannya apa? Sebab ada awet-awet cantik kat situ kan. Tujuan dia bukan sebenarnya nak buat physical activity. Target dia sebenarnya ada yang lain pula. Nak ngurat nak kacau anak dara orang. So dia become a barrier also. Because not really want to dia ada goal lain pula. Dia nak social interaction. And then types of physical activity. So type of physical activity, kalau you cycling, tempat tu quite busy with the car, kereta bawa laju, tak safe. So depend on the type of physical activity yang boleh dibuat kat situ. Ada kadang aktiviti tak selamat. Kadang-kadang you jogging, kawasan jogging tu, Kosong tu jauh daripada orang. Bahaya juga. Jogging tak balik pula. So this become a barrier. And then the last thing, your fitness level. Some of you really not fit to do exercise. It can be dangerous. So, my friends ramai yang meninggal. Dia main badminton tapi bila sebab mungkin dia ada short breaks kita pun kadang tak sedar fitness level dia tu. Dia bukan tak selalu main badminton tapi kita tak tahu dia punya level tu sebenarnya dia ada isu. Dia tak fit. It can become a barrier also. So all these things, the barriers that you must consider when you choose your physical activity or patient physical activity. You nampak ni? Ini masa dekat Jepun, I pergi Hugo Rehab Center. I buat attachment 5 bulan dekat Jepun. Very nice place. I buat dekat Hugo Rehab Center dekat Kobe sana. Dekat Kobe, dia punya terapis, dia buat physical activity. Kita main volleyball. Volleyball menggunakan belon for elderly. So physical exercise activity, play volleyball with the elderly patient yang ada ada physical problem or that dia guna wheelchair dia. So very exciting kat sana. So kita main volleyball balloon. Very nice playing. So you need to adapt you punya physical activity based on fitness of your patient. Sometimes some of your patient not fit. So you have to adapt, modify you punya physical activity. For example like this, you use balloon. Balloon tu kemudian hentangkan tali kat sini, net, dan kita main. Dia duduk dalam kursi roda, dia main play volleyball balloon. So when talk about physical activity, it can be individual or group. Individual or group. So one of the tools that you can access is using occupational self-assessment, OSA. Dr. Zami ada ajar OSA tak? Hello. Assalamualaikum. Ada tak dia ajar OSA untuk assessment? Ada ke tak ada you all ni? Hello. Tak ada
Ada.
What is OSA? Siapa yang cakap tu?
Professional self-assessment.
Ada berapa item tu?
Ada 21.
Okey, apa domain dia?
Occupational competence dengan occupational value.
Dia very good, occupational competence, occupational value, and dia punya domain, dia punya volition.
Saya tak ingat semua. Dia ada volition,
performance, and performance skill, kan? Ada 3 domain kat situ. So, kalau kita OSA ni good sebab this OSA ni for patient yang ada insight lah, yang boleh baca, dia ada insight dalam dalam diri dia. Dia boleh kita gunakan OSA individually, kita plan. So OSA ni kita boleh dapat maklumat. Saya akan tunjukkan maklumat dia punya tools tu. So dia ada 21 item. So we are able to understand our patient individually. Individually. So what are dia punya interrelation dia? Talking about dia punya performance capacity dengan dia punya volition, dengan dia punya habit. When talk about habit, dia punya routine dan sebagainya. So, so actually is good tools. Sekejap lagi saya buka. Oh, Dr. Zami ajar bagus. Dr. Zami dah ajar. Saya cuma wrap up sajalah. Bila kita buat assessment in term of physical, one of the tools that good for us to see individual need is we using OSA, occupational self assessment. This is the punya outcome. You ada manual dia tak? Dalamnya ada manual tak? Dia ada manual tak? Halo. Jangan lari semua.
Manual maksudnya borang assessment tu ke?
Bukan borang, manual dia. Dia macam mana translation dia apa semua. Tak ada.
Tak ada. Dia sebab Dr. Zami dia ajar assessment untuk psychiatric, so dia bagi buku manual assessment. Dalam manual tu cuma ada OSA tapi Malay version.
Malay version. You tahu siapa yang translate Malay version?
Doktor kan? Bukan sebab saya banyak jumpa artikel nama doktor.
Murad tu nama bapak saya lah.
Tapi doktor buat based on musculoskeletal disorder kan?
OSA ni good sebab apa? Kita dapat tengok dia punya apa problem dia. In term of dia punya competency and dia punya value. So dia ada 21 item. 21 item sini. Saya tak ingat dia punya domain tu, apa domain dia. Dia punya soalan item tu relate to what domain. So daripada sini you akan tahu apa kompetensi dia, apa yang dia punya value pada dia. So you boleh tengok value dia yang mana. Maksud priority lah. When talk about value ni, dia punya priority. Mana yang dia nak dulukan. So kita guna OSA. Is a good thing sebab contoh macam physically doing what I need to do, concentrating on my task. Kalau talking about physical activity, it can be contoh relaxing and enjoying myself. Kalau dia ada isu competency of relaxing and enjoying themselves, himself or herself, so kita boleh explore lagi apa yang benda yang tak relax, benda apa yang you tak boleh relax dan enjoy. Getting done what I need to do, so you boleh explore lagi. So this OSA is good for untuk dapat tahu patient punya kalau kita nak buat individual program for them. Okay. Ini case study. I want to show case study. In term of Lisa punya. Lisa ni dalam buku Jennifer Creek, dia dah interview patient tu. So bila dia explore lagi in term of dia punya habit dengan role, dia tengok relaxing and enjoy myself, having a satisfied routine. This is the item that identified by Lisa as being most difficult and most important to her, having a satisfied routine. So you explore lagi. Tak semestinya bila you dah assign ni, you need to explore. Lisa used to love to go swimming. and walking, but no longer feels able to. Now she rarely even takes the dog out to the park across the road. She does not participate in any leisure or social activity and is off work with depression. Once she has completed her household tasks, she sits in the chair all day, doing nothing. So this is the thing. Kalau tengok kat sini, dia punya habit, roles and routine, dia selalu pergi swimming. So swimming, tapi tak, but no longer feels able to. Dia rasa dah hilang motivasi, swimming and walking. So this is the thing. Bila you guna osak ni, you dapat tahu yang dia ni, this one that item that dia difficult nak buat, but very important to her. I tak nak pergi yang lain, cuma I nak discuss yang ini. So bila dia ada macam ni, so as a therapist, so you need to plan lah, because we as a therapist is a client-centered approach. Client-centered, based on client needs and dia punya value. Dia punya priority, dia punya needs and dia punya value. So dia punya value sekarang ni, swimming and walking. So you have to plan individual with Lisa to involve her back to swimming and walking. So when talk about this conceptualized Lisa volition, so kita tengok dia skill volition, dia ada masalah lack of self-confidence in herself. This is dia punya personal causation. Dia punya interest yang menyebabkan dia depressed, dia hilang enjoyment. Ini dia. Swimming. Ini swimming. Menyebabkan sebab apa dia duduk rumah? Probably dalam sini dia bila explore, dia rasa macam pakai swimming costume ni macam orang ketawakan dia. So that's why they sit at home all day. Lisa sees herself as worthless. Dia rasa dia tak berguna. Dia aktiviti yang dia previously enjoy dulu sebelum dia duduk rumah ni, berenang, walking. Tapi dia rasa kalau pakai swimming costume ni macam orang pandang serong kat dia. Orang ejek dia. Mungkin dia ada isu of body image ke, yang kita tak tahu. That's why you need to explore. So I kena admit Safia Nur Syahirah. So when use model of human occupation, dia actually interrelated. Interrelated in term of volition dengan dia punya values, dengan environment, dengan dia punya performance dia. Ya, macam ini dia performance dia affected because of dia punya volition dia, especially dia punya confidence, dia punya interest dah terganggu, disebabkan dia mungkin ada body image dia, dan dia value dia rasa diri dia tak berguna, worthless. Dia dari segi environment, physical dengan people, dengan social. So dia ada issue of poor relationship with husband. That's why tak ada support daripada husband dia, hubungan yang tak baik dengan husband dia. That's why dia ada masalah. Dia punya diri dan juga dia punya performance capacity, dia punya interest terganggu. So as a therapist, you need to work distinct lah. So kita sebagai terapi, kita tanya dia, do you enjoy swimming, walking? So kita kena bantu dia lah. Macam mana nak fulfill dia punya interest yang dulu. So you kena plan short term dengan long term. Probably swimming dulu dengan small numbers of people, bagi dia get used back again of activity swimming. Probably dia pun dia ada problem of fitness, build up dia punya fitness, and then cari kawan yang boleh interact, faham keadaan dia. Itulah tugas kita sebagai terapis. So I bawa you case yang high level lah, metropolitan ya, case lah. Bukan yang case kampung urban ya. So different case, different dia punya environment. And then we can do physical activity in group. In group. So there is a study they done in a group, community participation, activity in group, which is everyone knows right now, psychosocial punya approach. So this activity done by this mind organization. So kalau you buat activity dekat hospital pun, ataupun you work at a community, for example, health clinic, community, you boleh buat, you boleh design. You know what? When I observe early morning kan, yang banyak aktiviti in group physical activity ni Chinese, Melayu ni kurang. Mungkin ada, memang ada, tapi tak ramai. Yang makcik-makcik, even my wife pun, macam kat taman air tu dulu ada buat aktiviti senam aerobik dalam dekat taman tu, tapi hangat-hangat teh ayam. Sekejap dia dah hilang. Tapi Chinese, they engage in physical activity. They do tai chi activity, they do pagi-pagi dia buat senaman, exercise, dancing, zumba dan sebagainya. Tapi Malaysia memang kurang. So you kalau as a therapy also you need to design activity yang melibatkan group. This is involved. So you must have aims of the group. So your target in the group is to regular and maintain participation. So participation ni bukannya hangat-hangat teh ayam. Lepas 2 minggu dah berhenti dah tak buat. You kena maintain regular and maintain participation. Awareness effects of physical activity. So you effect dia, kesan dia tu, you kena bagi awareness pada group member tu. Supaya dia yakin bahawa memang ada kesan. Contoh macam dapat reduce weight, body mass index reduce, dapat reduce dia punya moody, improve dia punya concentration, sleep quality meningkat. You kena bagi awareness pada group. This is what your target. Dapat social interaction, dapat hilangkan boring kan. Improve mental well-being. Bila you buat activity in group, physical activity, you punya mental relax. You tak stress, tak under stress, especially yang umur 50 ke atas ni. Bila I tengok kan, orang yang kerja yang government yang high post, tapi dia tak involve physical activity, bila pencen terus macam-macam sakit dapat. Sebab dia tak mula awal, dia tak rutinkan diri dia daripada awal untuk buat physical activity. On routine of regular activities. So dia kena make it as a routine of regular activities untuk dia buat hari-hari. And then with this activity, you able to interact. Dapat kawan baru, member baru, dia punya isu pun baru, dia punya lawak pun baru, dia punya joke pun baru. Taklah, kalau you dengan macam I, kalau setakat lecturer OT ni benda yang sama je. Tapi bila I interact dengan golfer lain, yang pemain golf lain, dia punya apa, communication different, lain. Jadi you relax sikit kan. So you must objective. So you kena participate weekly walk, monitor feeling of mood and anxiety. So dalam bila buat aktiviti ni, you pun kena ada benda yang scientific lah, benda contoh you dapat monitor feeling of mood and anxiety. You dapat incorporate physical activity into lifestyle. Set individual goal. So you mesti ada goal. Kalau you buat physical activity, you mesti ada goal. You mesti ada target. Contoh macam kawan saya tu, dia cakap dia nak buat dalam 1 bulan 20,000 langkah, 20,000 step. Dia mesti ada goal dia lah. Kalau dia buat walking, every morning walking, mesti ada target. Dia target dia berapa ribu langkah. Target you nak reduce weight. Mesti ada goals. Personalized plan for continuation of physical activity into lifestyle. So you kena ada plan. You kena plan yang mana you able to participate. Make it your lifestyle. Personalized plan. Maksudnya, kalau lecturer tu, kalau dalam seminggu dia nak buat aktiviti fizikal, seminggu 3 kali, katakan. So katakan dia nak main badminton pukul 5 petang. So you kena personalize plan lah. Janganlah buat lab hari Rabu. Hari Rabu yang you plan main badminton. So you kena personalize you punya plan. So avoid kan aktiviti yang mana melibatkan you punya aktiviti. Make it as a lifestyle. Maksudnya every week tu ada seminggu 3 kali. Buat aktiviti you punya physical. Kalau di overseas, di Monash University, dia akan bawa bag salin pakaian. Lepas dia buat aktiviti, dia mandi, dia salin pakai baju, lepas tu dia balik rumah. Kalau nak buat aktiviti fizikal lepas balik rumah, maksudnya tak buat lah. Dia buat baju, aktiviti dia main, katakan main squash. I remember, seminggu 3 kali dekat Monash dulu, I main squash. Ataupun badminton. Ataupun yang perempuan tu, dia buat, dekat gym, dia buat senam aerobik. So, dalam masa 1 jam, dia buat senam aerobik untuk 3 kali. So, dia bawa baju basahan. Lepas dah siap semua, mandi. Lepas mandi, tukar baju. Tu balik. And venue. You kena sediakan tempat dia yang sesuai. Venue mana nak buat physical activity. And then there is evidence base. Evidence base yang saya dah highlight tadi. Pastikan benda yang you buat tu ada evidence. So, bila you buat aktiviti walking, contoh buat aktiviti walking, you ada topik untuk discuss. Sebab you want to make them enjoy with this activity. You want them to involve with the discussion. So, you come up with topic. Kalau macam rakan I, so dia semua dah berumah. Kadang-kadang topik itu topik about kahwin dua kan. Bermadu dan sebagainya. Dia sonoklah cerita tentang tu, tapi semua tak berani kan. Semua penakut. Cakap je. Tapi there is a topic to discuss. when they walk. Kalau you buat aktiviti dengan patient, mesti ada topik untuk cakap, untuk dia seronok untuk bercakap lah, untuk discuss. And assessment of risk. So very important, you assess the risk first. Kalau tempat tu banyak paku dan sebagainya, tak bolehlah buat kat situ. Tempat yang berbukit, bergunung ganang, ada bila hujan, licin. So this become a risk. Risiko dia tinggi, boleh menyebabkan kecederaan, kematian. So dia tak bolehlah lalu tempat tu. Contoh nak naik nak buat naik panjat Gunung Angsi, contoh. Gunung Angsi ni bila hujan lebat bahaya, tempat dia licin. So you must have assessment of risk. For example, you play golf. Play golf ni kalau hujan ribut dengan kilat is high risk. Sebab bila dia berjalan, dia duduk bawah pokok, pokok boleh tumbang kalau pokok yang reput dan sebagainya. So you need to have assessment of risk. And then self-monitoring. This one very important. Kalau you buat aktiviti yang physical activity, you kena ada self-monitoring. This one, self-monitoring charts and diaries. This one example of self-monitoring of psychological well-being and physical activity. So, you kena dia rate. For example, dia ada masalah anxiety, generalized anxiety disorders. So you kena tulis, kena suruh dia rate. Minggu pertama, how you describe, how you rate your punya anxiety. So katakan week 1 memula dia anxious, kata 8. Dan selepas aktiviti 4. So what dia kena comment, what the thing that trigger dia punya anxiety. I was worried about meeting new people, about being left behind in the walk. I feel much better now. I enjoy it. So this highlight the evidence, the thing, make that to prove them that that physical activity reduce dia punya anxiety. So, it is good that you ada chart and diaries. So, buatlah sampai minggu ke-12 tu. Macam mana rating dia. So, this become your record. The record, your punya documentation. What are the punya psychological effect to what the patient your client punya, in terms of doing walking, physical activity. And then, so another way to record is to record dia punya physical activity in terms of dia punya intensity ataupun dia punya frequency. Sebenarnya frequency dia punya masa tu. Sebab kita nak increase dia punya endurance. Di endurance dia, kalau dulu dia boleh, dalam minggu tu dia boleh buat only 10 minutes. Then week 2 dia dapat buat 50 minutes. Week 3 20 minutes. So indirectly be able to count dia punya endurance. Endurance dia every week. This reflect the performance of this when they do physical activity, dia punya walking dan sebagainya. Okay. This is example of the physical activity. Dia punya benefit, dia punya effect of the physical activity and the process we do in terms of individual and dia punya in a group. So ada soalan tentang ni semua? Alia? Ras? Ada soalan tentang apa physical activity ni?
Tak ada.
Semua faham?
Faham.
Faham.
Faham? Faham ya? Kim? So, saya akan uploadkan ada material tentang apa artikel dan juga OSA punya apa saya punya artikel saya publish dekat, saya buat translation OSA in Malay. Saya publish dekat apa ni British Journal. You boleh baca. Okay. Kalau tak ada soalan,
Doktor,
ya, Nurul.
boleh tolong masukkan lecture note dari week 3 tak?
Baik, week 3 tak ada? Ya ke? Bukan, saya dah masukkan dalam
Week 3 kan ada yang buat seminar tu kan. Yang week 4 tak ada. Week 4 yang behavior tu.
Oh, behavior tak masuk lagi ya?
Doktor masukkan video je.
Oh, video. Lupa saya. Nanti saya masukkan okey. Lagi? Kalau tak ada, kita ada lab kan besok kan? Group B ke group A? Group A besok?
Group B.
Ya, group B So kita jumpa esok lah
Doktor.
Ya, siapa ni?
Saya lagi.
Lupa lagi tu.
Boleh tak doktor tolong share markah untuk assignment yang dekat lab?
Dekat lab tu, you all semua nak tengok markah. Okey, nanti saya sharekan dekat dalam apa? Dalam future lah. Alright? Okey? Semua nak
Thank you,
tengok.
doktor.
Okey. Alright okey, kita jumpa besok ya. Tang group B. Okay, see you tomorrow. Bye.
Bye.
Thank you, sir.
Thank you, doktor.
Thank you, sir.
Bye, sir.
Doktor.
Bye.
Doktor.